I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Please show your face in the video. As a reminder, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown below or shown here on the side. So this is a reminder after the pep talk. And then another reminder, especially for those old-timers, 50 OLETES certificates would entitle one mentee to a voucher for a ROJoson medical consultation, either face-to-face or telemedical. The vouchers is shown here. Then another request, please type in your feedback in the chat box before the during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the pep talk proper. Okay. One. Christy, your face is not in the center. One, two, one, two, one, three. 1, 2, 3. Okay. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. And since October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer, depending on our enthusiasm, discipline, and perseverance. So by May 15 this year, we will be ending our 3rd year of pep talk. Okay. My pep talk today is entitled Breast Self-Exam Awards. This serves as an orientation for the start of the Breast Self-Exam Award Year 3 or 2024. The empowerment objective is for the lay people to have an essential understanding of the importance of breast self-exam awards in the promotion of early detection of breast cancer. The contents of this particular pep talk would be the following. What is a breast self-exam? What are the ultimate causes why a lot of Filipino women are not doing regular breast self-exam? What is the most common myth that is causing a lot of Filipino women to not doing regular breast self-exam? What are the flimsy reasons that are causing a lot of Filipino women to not doing the regular breast self-exam? And what is the ROJoson's advocacy on breast self-exam? What is the breast self-exam awards? And what are ROJoson's parting tips on breast self-exam and also the awards? As a disclaimer, this pep talk will contain my thoughts, perceptions, opinions, and recommendations culled from my personal experience as well as from the experiences of other professionals. What is breast self-exam? It is an examination of one's own breast. In Tagalog, is pagsusuri sa sarili sa dibdib or pagsusuri sa sariling suso. This is in contrast to an examination of the breast by another person, usually a healthcare professional, usually a physician. A nurse can also do that. Okay? And breast self-examination, if it's done by somebody else, another person, it's called breast physical exam or clinical breast exam. And it's not anymore breast self-exam. So basta breast self-exam, the the person doing it herself on her own breast. When one says breast self-exam or breast physical exam or clinical breast exam, one refers to an examination using the naked eye to look or inspect and using the fingers of the hands to palpate or press the breast and gently squeeze the nipples. So these are the essential components of a breast exam. Okay. Looking, inspecting, and palpating and squeezing the nipple. So looking, palpating, and squeezing the nipple. Okay. So this is the first one is this is breast self-exam. This one is this illustrates the breast physical exam or clinical breast exam by another person. Okay, so the professional looking at the breast of the patient and then palpating the breast and then squeezing the nipple. So these are the essential components of a breast exam. Now, this is in contrast to examinations using ultrasound, mammography, biopsy, and other diagnostic procedures, like this one showing the ultrasound, mammography, and needle biopsy. So this is not part of the breast self-exam or breast exam, no, or clinical exam, breast clinical exam. So it's examination using diagnostic procedures. So again, to illustrate, okay, looking through the mirror and then palpating and then squeezing, breast self-exam. And what are the ultimate causes why a lot of Filipino women are not doing regular breast self-exam? Breast self-exam has long been recommended and advocated as a practical and useful strategy in the early detection of breast cancer. It has been recommended and advocated since time immemorial and up to now, 2024, this year. The problem is not all women, Filipino women at that, have taken up the health habit seriously, which has been advised by physicians and breast specialists as a no-cost strategy to detect breast cancer early. Usually, wala namang gastos, no-cost strategy. This is in spite of the internet and social media and public health education being flooded with advocacy for breast self-examination. The same problem with in the breast self-examination is seen in those other advocacy, such as physicians advocating regular exercise as a no-cost strategy to reduce cardiovascular disorders. Marami pa rin hindi gumagawa. Okay. The ultimate causes of this non-compliance on the recommendations of the physicians on regular breast self-examination and regular exercise are, number one, lack of discipline. Number two, lack of perseverance. Yan lang nakikita ko. Lack of discipline, this is the ultimate cause. Mamaya may mga contributory cause like doesn't know how to do it, and then maraming myth, maraming paniniwala. No? But these are the ultimate cause, lack of discipline and perseverance to do breast self-examination. Of course, there are other causes, but these can easily be remedied, like ignorance and myth. Okay. What is the most common myth that is causing a lot of Filipino women to not doing regular breast self-examination? Number one, a lot of persons believe that pressing or squeezing the breast leads to cancer. This is not true. Okay, hindi totoo ito. And then the other myth is, yung mga common reason is, I don't know how to do breast self-examination. I'm afraid to find something in my breast that will cause me anxiety. So these are common reasons presented by lay people who do not do regular breast self-examination. I don't know how to do breast self-examination is a flimsy reason because one can be taught as long as there is an interest, willingness, discipline, perseverance to learn. Okay? Breast self-exam is simple, just inspection and palpation. It takes less than 3 minutes and even less, and it costs nothing. Okay? I'm afraid to find something in my breast that will cause me anxiety. Again, this is a flimsy reason, because if a BSE can detect breast cancer early, in the early stage with the benefit of saving your life, you will not be forwarding the above excuse. What is the ROJoson's advocacies on breast self-examination? Personally, as a physician specializing in breast cancer, I have been advocating breast self-examination since 1982 when I started my private practice, and up to now, 2024, okay, and that's more than 40 years. I've always felt sad, disappointed, and frustrated, especially when I would see patients with advanced breast cancer coming to me and knowing they were not doing regular breast self-exam. I also have been feeling frustrated when my advocacy has fallen on deaf ear by majority of Filipino women. I care for them, they won't listen to my advice. So in fact, I sent a lot of information, uh, yung mga notices on this topic, pero up to now, 10 lang nag-attend pa rin. No? So as I enter my twilight years, I will make a last-ditch attempt. I know and accept that I will not be able to convince the 37 million adult Filipino female population. Okay. There are about, estimated 37 million female adult population in the Philippines. I will just be contented if I can inculcate breast self-examination as a health habit in 200 adult Filipino female women before I die. 200 lang, pwede na. This is an arbitrary number, but 200 pwede na. In 2022, I started the Breast Self-Exam Awards, and I was able to inculcate breast self-exam as a health habit in 65 Filipino women. In 2023, last year, I was able to inculcate breast self-examination as a health habit in 22 Filipino women. Kumonte. Total, as of today, is 87 Filipino women. So in 2024, I will try to reach 200 persons goal. Kulang pa ng 113. So 113 more. So I hope I can achieve this with your help. Okay. And for these kinds of awards, we have given out more than 50,000 pesos cash awards in 2022 and 2023. As I said, this is my last-ditch attempt in my advocacy of breast self-examination for Filipino women. This has not been done before by anybody, I think. I would go out of my way to give incentive cash awards to Filipino women who would do monthly breast self-exam for at least 9 months. Kahit na 9 months lang, pwede na. So what is the Breast Self-Exam Awards? This project was launched in January 15, 2022. The primary objective of the club or awards is to promote early detection of breast cancers among Filipino women. Specifically, to promote and advocate the practice of a health habit called regular breast self-examination, BSE, among Filipino women, so that in case a breast cancer strikes, they will be able to catch it early enough and have it treated as soon as possible. Here are the general mechanics of the awards. I will teach the registrants on how to do breast self-examination, teach them how to interpret the findings, document their performance of regular breast self-examination for at least 9 months with a report card and a video every quarter with clothes on, a total of 3 videos only, incentivize them with certificates and cash awards. So these are the general mechanics that I've been using for these awards. This has been going on for the past 2 years, 3 years. Okay. So teach the registrants on how to do breast self-examination. So I will give the link to the learning materials later on or in some other time. Okay. So palpating the breast using the flats of the fingers. Okay. And still palpating the whole breast. Then squeezing the nipple to see for any discharge. And then palpating the axilla for lymph nodes. And then do the same procedure on the other side. Okay, palpate the breast, okay, with the flats of the fingers, and then squeezing the nipple, and then with the arms down, palpating the armpit. Okay. So during the palpation of the breast, dapat nakataas yung kamay para ma-stretch out the whole breast. Pagkapa ng axilla or the armpit, no, baba naman. Parang ito, nakababa, no? Ito, pagkapa ng breast, nakataas ang kamay. Pagkapa ng kilikili, nakababa itong kamay. Para nakalax itong relax yung balat dito sa kilikili, no? So, teach the registrants on how to do breast self-examination is, okay. So I will have a pep talk again next week. Okay, this is on breast self-examination, a health habit to cultivate. And then also, this will be accompanied by the online learning comb evaluation test exercise. Teach them how to interpret. Okay, part of the learning that will be conducted on this particular topic, health habit to cultivate, will be to learn how to interpret. Kasi mga ina-advocate sa internet palaging how to do it, pero walang tinuturo na how to interpret. So the third strategy that I have been using for this award is to document the performance of regular breast self-examination for at least 9 consecutive months with a report card and a video every quarter with clothes on, as you have seen in the slides in the past 2 slides. Okay, total of 3 videos lang. So February to October, so that's at least 9 months. Okay. So those who have joined now, January, so pwedeng January up to October, or those who will come in late by March hanggang November or December. Basta at least minimum of 9 months. So this is a sample of the report card that will be submitted, okay, the date, the month, and then just put in the date, okay, when the monthly breast self-examination is done, and then and also when a video was submitted. Okay? And then put down the findings, whether unusual findings or there is some findings, and then describe, and then disposition, whether to observe or to consult a breast specialist. Okay. So the coordinators and members doing the monthly breast self-examination for at least 9 months must submit, ito lang ina-expect ko sa mga coordinators and members, to submit a report card like this and a video of BSE with clothes on once every 3 months. So walang break in privacy ito. Huh? Okay. Nakadamit naman. Incentivize them with certificates like this. Okay. So this is an example of a certificate given to Zenaida Cabral last year, okay, November 2023. And then we will incentivize them with aside from the certificates, they will have cash. So for the BSE coordinators, each will receive 500 pesos at least, and then plus 100 pesos per recruited member. For the members, they will receive 500 pesos each, doing monthly breast self-examination for at least 9 months. And then there is a special ayuda for breast cancer discovered early in the T1 or T2 stage, meaning the size of the tumor is less than 5 centimeters. T1 means less than 2 centimeters. T2 means 2 to 5 centimeters. So usually early stage pa yan kung na-discovery and that size. So ayuda for breast cancer discovered early through the monthly breast self-examination. Then the cash award would be, ayuda award would be 5,000 each for each person who will fall under this category. So to repeat, eligibility for certificates and cash awards, a report card, a video with clothes on, at least 3, and then a perfect score on the elective on the breast self-exam. Other details for the breast self-examination, especially for 2024, okay? So there are 2 categories of BSE promoters and practitioners. You have the BSE coordinators and BSE members. The BSE coordinators consist of breast cancer patients who practice breast self-examination and will promote the practice of BSE among the recruited members. So magre-recruit siya. So BSE members naman who have been certified as BSE practitioners in the past year, 2022 or 2023, are now eligible to become BSE coordinator for 2024. So if these are not breast cancer patients, kung meron silang ma-recruit, then they will become coordinators. The BSE members consist of Filipino females who have been recruited by the BSE coordinators. So just to repeat, 2023, last year, BSE promoters and coordinators can still join but have to recruit new members. And then the 2022-2023 BSE practitioners are eligible to become BSE promoters and coordinators. Duties and responsibilities of the BSE coordinators: train, supervise, and coordinate the recruited BSE members in accomplishing the requirements in the BSE awards, then submit to ROJoson the report cards every month, and BSE video every 3 months of BSE members and also their own report cards. Then certify the completeness and accomplishment of the requirements of their BSE members. Then attend the BSE, the pep talk on BSE, and pass the olete on BSE. Duties and responsibilities of the BSE members: fulfill the requirements of the BSE awards, do monthly breast self-examination for at least 9 months, submit to BSE coordinators the report cards every month, and BSE video every 3 months. Attend the ROJoson pep talk on BSE, breast self-exam, and pass the olete. How to register: submit registration forms, report cards to ROJoson through email. Okay. This is my email address. Indicate the name of the BSE coordinator and indicate the names of the recruited BSE members. The deadline for submission is January 31, 2024. Malapit na. So that's about 11 days from now. Awarding will be for this year will be December 1, 2024. This will be time with the 37th Cancer Crusaders Club annual Christmas get-together virtual meet. So here are sample feedback on the BSE. Being one of the coordinators, I'm able to educate my family and friend on how important to have a monthly BSE. This would help oneself to detect any possible problems earlier, especially with our family member or with our family who have a history of cancer. My auntie and my first cousin just died of breast cancer 2 years ago. I wish that by practicing this, No more from my family will undergo the same thing that I have undergone, and I wouldn't want to lose anyone from my family with this sickness again. Another feedback, instead of doing BSE occasionally and haphazardly, the project gave me a chance to do the BSE in the right way on a regular basis. I will encourage folks and friends to do the BSE and perhaps ask them to join in this project. Another feedback, this project on regular BSE will help a lot of women in the early detection of breast cancer and also alleviate unnecessary visits to the doctor. I will promote BSE among my friends by teaching them how to properly perform BSE and by telling them the many benefits of doing BSE on a regular basis. The benefits of this project regarding the regular BSE will help a lot of women in the early detection of breast cancer, especially those who don't have the means to pay the mammogram and ultrasound on a regular basis. The most tangible outcome of the BSE awards occurred this year, late last year, and also this year because the patient was operated on early just a week ago. Okay, so a BSE coordinator reported on November 2023 that her sister was able to discover an early breast cancer because of the project. Here, this is her message to me. On behalf of our whole family, we are deeply thankful for imparting your knowledge to us. One of my sister, who was a member of the BSE last year, has learned that she has a small cyst or mass in her breast. She had continually practiced to do BSE, and without this knowledge, she would not have detected the cyst. So this cyst turned out to be cancer. This passion of yours to teach us about the awareness on breast self-examination has greatly benefited us. So, her sister was able to discover the early breast cancer because of the project. She was given 5,000 pesos ayuda for her treatment. I just gave her the 5,000 last week, right? Even before she was discharged from the hospital. So this is the message of the patient o the daughter. Marami pong salamat sa 5K na binigay mo po sa mama. Na-discharge na po si mama kahapon. Thank you for the concern, for all the help po. Laking tulong din talaga nung PW card para kay mama. Before she was operated on, I asked her, after the biopsy, I gave her her certificate to get a PWD card para magkaroon po siya ng 20% discount from all her medical expenses. So malaking tulong daw ito. So thank you din po sa pag-mention sa amin about the PWD card. Kasi konting doctor lang may gumagawa nito. The moment there's a person with a cancer, I usually ask if they're less than 60 years old, I usually advise them to get a PWD card. Entitled sila doon. Okay? So all patients, cancer patients who are under 60 are entitled under the law to have a PWD card. So inasikaso ko po agad the requirements after the checkup with me. Okay. Okay. So as I said, this patient was given 5,000 ayuda for her treatment. So we have, as I said, this is the most tangible results of the objective of the awards to promote and advocate the practice of a health habit called regular BSE among Filipino women so that in case a breast cancer strikes, they will be able to catch it early enough and to have it treated as soon as possible. So this was illustrated in this particular patient. So what are ROJoson's parting tips on breast self-exam and the awards? Do regular monthly breast self-exam. It is the best strategy against breast cancer, which is simple, practical, no-cost strategy, walang gastos, for early detection, and it can save life against breast cancer. Look and palpate for anything unusual on the breast. Madali lang naman, hanapin mo lang anything unusual. Yan ang starting point for uh, consulting, for interpreting, and then consulting the physician, the breast specialist. So if there is anything unusual that has been found, consult a breast specialist right away. So the project, as I said, was launched in January 15, 2022. We will be continuing this award for year 3, 2024. The primary objective of the club is to promote early detection of breast cancers among Filipino women, and the specific objectives will be to promote and advocate the practice of a health habit called regular breast self-examination among Filipino women, so that in case the breast cancer strikes, they will be able to catch it early enough and have it treated as soon as possible. So you and your relatives and close friends, join us. Protect yourself and your loved ones. Again, to repeat, the deadline for submission will be January 31, 2024. So to repeat, the objective of this award will be to promote, advocate the practice of a health habit called regular BSE among Filipino women, so that in case a breast cancer strikes, they will be able to catch it early enough and have it treated as soon as possible. So that's my last slide. Okay. So last slide for the content. Okay, I have practically covered everything here, listed down here. And then takeaway in relation to patient empowerment, be always in touch with reliable medical information on importance of breast self-examination. Knowledge is power, it gives power. Use the 4Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions in doing breast self-exam for the early detection of breast cancer. So this ends my pep talk this afternoon. Breast self-exam awards. I hope I have empowered you to have an essential understanding of the importance of breast self-exam awards in the promotion of early detection of breast cancer. So before we go to the QA portion, reminder, after the pep talk, please take the OLETE for mastery of learning and get a perfect score to get a certificate like this. I placed the link in the chat box. Obtaining 50 OLETE certificates will entitle one mentee to a voucher for a ROJoson telemedical consultation, either face-to-face or telemedical. Again, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the interactions. Please turn on your video now. Show your face. Okay. Ready? 1, 2, 3. 1, 1, 2. Gumagalaw sila. Keep still. 1, 2, 3. 1, 2, 3. Gumagalaw sila. Okay, gagalaw. 1, 2, 3. Okay. Let me save it first. Okay. So the floor is now open for comments, questions. Anybody who will be joining this year? 2024, as I said, I'm still targeting 113. 113 pa. Okay. Sino gustong sumali? I'd like to tell you that just a few minutes ago, I received a, yeah, Chris is here. Chris Nesesha is here. She already submitted a list of 3 members. Okay. Chris,
Hello, Doc. Good afternoon.
yeah, you there? Yeah, you want to say something?
Yes, yes po. Actually, I just want to share, no, napakalaking tulong po nitong BSE na nililid ni Doc kasi naubos ko na yung family ko kasi it's going to be 3 years na ngayon, Doc, 'di ba? Nag-start po kayo. Naubos ko na yung family ko. So, what I did is nagtingin ako sa mga possible din sa mga kapitbahay namin and then inalok ko sila na kung pwede ganito, hindi talaga nila alam how to do the BSE. Hindi
Mhm.
nila talaga alam, Doc. And then, tinanong nila, para saan yan, ate? Ganyan. So, in-explain ko na halimbawa, like me, nagkaroon. And then, hindi na siya lalala. Pag may, kasi yung dalawang teenager ang kinausap ko kasama yung mother nila, at saka yung lola nila. And then, pati yung older one, yung lola nila, wala din silang idea on how to do the BSE. Wala silang idea on checking on their breast. Wala talaga silang idea, Doc. So, sabi ko, lead to ni Doc Joson na sa natin against breast cancer and it will be helpful to us. Then, tinuruan ko sila while nag-video kami. Tapos sabi ko, let's do this every month ha. At they're happy naman po dun sa bago nilang learnings. Nakakatuwa po itong um, yung naging team ko po ngayon. Thank
Right.
you, Doc Joson.
Yeah, thank you also for supporting this advocacy. Tumutulong
Always
ka,
po.
matutulungan ka rin somehow. Babalik sa iyo yung grasya.
Thank you pa din, Doc. Sobrang dami din po kayo natulong po sa amin, not only for me, but to the whole family, sa mga kakilala namin. Thank you so much,
You're
Doc.
welcome. Okay. Anybody else who wants to join this year? Perla, you want to join? Okay. Lordy, may sasabihin ka? Lordier? Lordy, Ricoforte. Okay, wala. Okay. Anybody else who wants to make a comment?
Doc, ako may question. I have
Sure,
a question.
sure.
Yes.
Okay, Maria. Okay, Husta.
Yes. So,
How do I call you ba? Husta, Maria?
kahit ano, okay lang. May family din.
Ano bang usually tawag sa'yo?
Sa, sa family, Mary.
Mary,
Sa friends, Husta. So,
Husta.
it's, oo.
But what's your middle name?
My middle name is Trinidad.
Trinidad. Not okay. So, Maria Husta Trinidad Polotan. Okay.
That's
So,
in,
it's either
nasa
Mary
birth.
or Husta. Okay. So, at least I know.
Opo. Yung so I do BSE every other day when I take in the bath. Yung problem, well, kasi my, I'm a little on the big side. I mean, my breasts are on the big side. So, is it right that, kasi so you start here, sa lower half, I have to lift it with my palm before I can continue
Okay. Kasi
in
kaya
the
nga,
breast.
rational for
Right?
the rational kasi yung tinataas, yung
Yes,
kamay.
pero kasi syempre gravity has taken over because of
Tama.
age.
Okay. So,
It's,
it's
it's
So it helps
It,
lang but not totally kasi kung minsan yung malaki yung breast ng babae,
yeah,
minsan
sagging. Oo.
nagsasag, di ba? So
So is
just
that
press,
right?
ano lang, just press it, sandali
Opo.
i-ano mo lang, just press it harder.
What I
Ganun.
do ho is I lift it.
Paano, how do you
And
lift? You have only one
with,
hand. I lift it with,
with my, sorry. Yeah, with the palm. And
okay.
then I you.
Tama yun, tama. Tama. I-lift mo.
Oo.
Basta you
Oo.
should be pressing your breast against the chest
Yes.
wall. Okay?
Yes.
Huwag yung
Oo.
ganon, ha? Huwag yung ganon.
I know.
Ha?
Yes.
Kasi
No,
mga
talaga ho
tao,
yung
ganun ka pa. Pag ganun ka pa, may makakapa yung breast mismo. No? Okay.
Oo.
So, ganon.
Yeah. Oo.
Nakatiin. No? So, itaas mo na lang. Kung, no?
Oo.
Ganon.
That's why I was thinking ho, is it all right, better to do it lying down?
Um,
I haven't done it ho. I've always done it standing up.
if,
Or yeah.
I think
I'm
it's not
not sure na.
absolute. It's not absolute, pero i-testing mo na lang. If you feel that it will be easier for you to do it, yung concern mo, baka hindi mo makapa yung sa ilalim, no? Yung mga ano. You see, check mo na lang kung if you feel that, if you lie down, kung ma-stretch yung breast mo pataas, then mas madaling kapain, do so. Okay? Kaya ang problema lang sa lying down, kasi yung recommend ko, just when you're taking a bath, pwede nang gawin yon para instant.
That's it. You might forget if you, right,
you can reinforce that when you are about to sleep na. I-check mo lang.
maybe.
Ganon. Kung nakahiga ka na. Okay?
Kasi ganun ho, I mean, lift.
Yeah, tama
Kasi,
yun. Kasi yung mga, kami naman, when we palpate yung mga malalaking breast, we usually use 2 hands, no? 2 hands to palpate, no? Okay, you one hand is to support it para
yes.
i-stretch siya, itabi, no? Then kapa, i-flatten mo na, gano'n, no?
Okay. At least.
Iba,
Then what about skin tags? So I have a skin tags
sa breast.
one. Because that's where I perspire a lot. So do I do something about it or do I just leave it? Because I read that if it doesn't bother you, you can leave it.
Yung skin, make sure it's skin tag, ha?
Yes, it is. May neck ho talaga and I can actually pull it.
Neck. Okay, yeah, kung may neck, okay lang, ha? Okay. So if it's small, if it's not bothering you, no, you can leave it at alone. But if you want to have it removed, pwede rin. Madali lang naman yon, no? So ikakat lang naman yon, no? Okay. So just make sure that it's really skin tag, ha? Kasi kasi last, kailan pa yun? 2 weeks ago, 3 weeks ago, I have a patient na may parang skin problem, no? Which I think still skin problem. Nagmimic as breast cancer, no? Okay. So, ngayon, I treat it as, kasi 4 years na yun, hindi naman siya lumalaki, wala siyang bukol galing sa breast. So, I treat it as parang skin cancer, no? Pero lumabas sa histopath, sabi nila galing sa breast, pero I'm still questioning that, pinapa-review ko, mukhang hindi, no? Kasi very rare nga. You can have skin cancer of the breast kasi yung breast may skin, di ba? May balat. So that could be a source for the breast cancer also. Okay. So kung di mabusis meticulous yung surgeon o kaya pathologist, ma-interchange na yung dalawa. Kasi ibang gamutan sa skin cancer of the breast and breast cancer itself, no? Okay. Mas delikado yung breast cancer kaysa skin cancer, no? Okay. So just make sure that it's a skin tag, no? Okay.
Yes, it has a neck and everything.
Yeah, kung may neck, most likely.
Dito sa the ones here. Sa
Meron
neck.
ka? Parang wart, no?
Yeah, yung, di ba, skin tags dito sa leeg. Ganon siya.
Skin tag can be anywhere. Pwedeng sa ibang lugar. Okay.
Mm.
Skin
Okay.
tag. Isa sa hita, meron akong skin tag noon. No? Meron din. Ganun. Okay. Anything
Okay.
else?
Thank you, Doctor.
So,
Yun lang
how
po.
long have you been doing your breast self-exam? Tagal na. I hope.
Matagal na. So po, since mommy,
Okay.
since 20, when did we go to you? 2016.
2016. Okay. May kapatid ka mga
2016.
babae? May mga kapatid ka babae,
Ay,
kamag-anak?
no,
Wala.
no, wala ho.
Wala.
I'm
Okay.
alone.
So, I like to offer this to mainly to those with breast cancer who have sisters, di ba? Kasi they're at higher risk, no? Sisters, no? Mother, ganon, no? Okay.
Sisters po. Maybe I can ask, I don't know. I'll ask. I can ask my neighbor because she just had an operation a few 2, 3 months ago
Breast cancer
for two,
or
breast cancer.
breast cancer?
Uh, yes, so my
No.
neighbor. We just found that because she was very personal, very private. So
Oh,
we found out just before Christmas. So I can ask her to join the
yeah,
talk next.
yeah. So, if they
Yes,
can join, kahit na hindi ko pasyente, they can join. No,
opo,
they can
opo,
join this
opo.
lab as long as
Mm,
they report to me. No, okay.
mm.
They document
Ah,
everything. Example, that patient was not operated by me, di ba? So she's qualified to join. No,
opo.
okay.
Yes po. Yeah,
Yung,
I'll ask her.
yung ayuda na binigay ko naman, I didn't force her to be operated by me. She had it done in a government hospital. Na binigyan ko pa rin ng ayuda for 5,000. Na? Okay. So that's part of the
Thank you po.
objectives of it. Na?
Yes.
Oh.
Yes.
So kung meron kayo mga friends, kahit na hindi ko pasyente, they're welcome to join. Na? Okay. So tinatarget ko 113 pa. Baka after that, wala na akong fans. Okay. Wala na akong pondo. Mauubos na. Okay. So any more? Charlita. Kat, sali ka, Kat? Kat, Kat. Kat, Kat, Espero.
Ah,
Sali ka?
opo, opo.
Yung sa'yo, thyroid lang, pero who knows? No?
Dok, ask ko lang, may possibility na magkaroon ako niyan dahil thyroid lang. Wala naman.
Oo.
Mm,
What's a question? Lahat tayo, pwede tayong tamaan kahit na kahit na kahit iba, 5 sakit pa nga di ba? 5, 6, iba-iba, di ba? So, habang buhay tayo, maraming tayong challenges, no? Okay.
pero sa boys, bihira.
Boys sa breast,
Yes po.
bihira. Pero meron din, bihira, pero meron, no? At the ratio of 1 to 100, kung 100 female, isang lalaki, ganon. Yan ang ratio noon, no? Meron din. May kilala ka bang lalaki na may breast cancer?
Mm,
Ha?
kapitbahay namin bakla, kakainom lang niya ng yung kakainom niya ng kung ano-anong hormones, parang nagkaroon na po yata siya. Hormone pills, di ko naoperahan siya nung etong third week ng January.
Okay. Bakla. So bakla, lalaki siya. Lalaki siya, uminom siya ng mga hormones, no?
Opo, malaking boobs niya eh. Parang babae na nga eh.
Oo. Pero breast cancer ba? No ba? Hindi naman.
Sabi nung kapatid, breast cancer daw.
Okay.
Bandang chest daw, yun ang sabi ng kapatid eh.
Okay. Hindi ko alam kung dahil sa mga hormones na iniinom niya, no? Mahirap sabihin, no? Okay. So, if you want to join CAT, wala kang di ba? You can be a member of either, kay Chris, pwede kang sumali kung wala pa siyang no? Okay.
Okay ba?
Okay, yes. Kay Abet, pwede kang sumali doon, no? Para maturuan kayo, no? Okay. Sabihin mo lang, ha?
Okay po.
Contact mo na lang si Abet. Kilala mo si Abet, di ba? Kilala mo?
Hindi
Kilala
po.
Ha?
She knows me as Beth.
Ah,
Oh,
si Bet lang po, si Ma'am Bet.
ayan, sige. Pwede kang sumali dyan. Baka magpatayo na isang grupo si Beth again this year. Okay. Any more? If there are no more questions, oh, sige, Lord.
Doc,
Yeah, sige,
Doc,
Lord.
ako, Doc.
Go ahead.
Doc,
Ano? Lord,
Doc.
yeah,
Ay,
naririnig kita.
ay.
Go ahead. Go ahead, Lordy. May sasabihin ka?
Doc, meron na po akong na-recruit, Doc.
Good. Very good.
4 po.
4. Wow, very good. No?
Di ko po masyado, Doc, marinig. Mahina yung boses niyo po.
Mahina yung boses ko?
Opo.
Okay.
Kaya inaano ko yung ano nyo sa tenga ko.
At naririnig kita.
Ganun po.
Naririnig niyo ako, the rest? Abet?
Yeah,
Clear-
very
clear,
loud and
Doc.
clear.
Opo.
Oh.
Oh,
Ang problema
it's
kasi
only
mo,
Lordy.
baka yung earphone mo, yung ano.
Oo nga po, Doc.
Sige, thank
May
you for...
na-recruit na po ako 4.
Very good. Very good. So,
Okay.
sige. So, sali pa kayo. Okay. So, if there are no more questions, we'll call it a day. Next week, we will...
Doc,
Yeah. Chris.
sorry Doc.
Good. Sige.
Yung i-share ko lang yung sa mga kahit walang breast cancer. Maganda ang lagi kong pina-practice to share yung kay Ma'am Mary. During taking a bath ko kasi madulas tapos mas na feel ng palm mo yung yung dulo ng fingers mo yung loob ng breast mo. Kaya maganda po kapag during taking a bath po. Yan
Yeah.
lang.
Yeah.
Just to share. Thank you.
Yeah. Okay. Thank you. Thank you for sharing. Okay. Yan ang
Peter,
masaya.
I have a Viber message for you from Senisa Ramos.
Nasagot ka na. Okay.
Okay.
Anything else you want to say, Abet, sa Breast Self-Exam Awards?
I will reform the group that I created last year. Be
Oh.
more stricter.
Oo. Sige na, baka matapos na yung itong program nito. Naka-3rd year na tayo no?
Kaya nga.
Actually,
Okay.
na-achieve ko yung tangible results. Sabi ko, pwede na ako. Pwede na yun. Yan ang pinaka-importanting results. Di ba? Okay. Yung nakadiscover ng breast cancer na maaga at nabigyan ng ayuda ng 5,000. Okay. So, no more? Last call? Okay. If there are no more questions, no more comments, we'll call it a day. We will have the next topic will be breast self-exam, how to cultivate that as health habit. Yan, explain ko in details how to do it and then how to interpret. No? Okay, next week. No? Okay? So if there are no more questions, we'll call it a day. Goodbye, good night, have a nice weekend. No?
Thank you po.
Thank you po.
Thank you, Doc. Thank you, everyone. Bye-bye po.
Bye-bye. Bye-bye.
Happy weekend po sa lahat.
Happy weekend.